For today's topic, we'll be discussing benign prostatic hyperplasia, aka BPH, which will be looking at the prostate gland. The term hyperplasia refers to an increased number of cells within the prostate gland, which causes the prostate gland to become enlarged. The term benign at the beginning means that these cells that are increasing are not malignant. The enlargement of the prostate can become problematic for your male patient when the enlarging prostate tissue begins to compress the urethra. This condition is common in males over 50 years old and is considered a normal part of aging. The prostate gland is small, about the size of a walnut, that sits under the bladder and in front of the rectum. The urethra starts at the bladder and must pass through the prostate to empty urine from the bladder. The portion of the urethra that passes through the prostate is called the prostatic urethra. Causes of BPH focus on aging and endocrine factors of androgens and estrogens. Testosterone is the primary circulating androgen in men and can be metabolized into estradiol, which is a potent estrogen. Since the prostate is an estrogen target tissue, estrogens directly and indirectly affect the growth and differentiation of it. Like we said before, this condition, fortunately, is benign, so there is no risk for development of cell mutations that can lead to prostate cancer. The entire prostate gland seems to enlarge very uniform, and small hyperplasic nodules can form within the inner portions of the gland around the urethra. These nodules are what press on the prostatic urethra, making it difficult for urine to pass through. This can cause urine to build up in the bladder, which then can also lead to bacterial growth from the stagnant urine. That bacterial growth can then lead to urinary tract infections for these patients. Symptoms of BPH start at the point when the prostatic urethra starts becoming obstructed. With obstruction, the force of the urine stream becomes significantly reduced, causing a weak and inconsistent stream of urine. You may hear this referred to as dribbling from your patients or other nurses. These patients may also have to strain to urinate, complain of pain with urination, and or also complain of having trouble initiating urination. Also, with having buildup of urine in the bladder, it gives the patient the sensation of needing to go to the bathroom more often, especially at night, which is termed nocturia. This condition can be diagnosed by the physician performing a digital rectal exam or by using lab work. For BPH, you would be looking at the lab value of the PSA, which stands for prostate-specific antigen. In BPH, this lab value will be elevated. Treatment to allow urine to flow normally and relieve obstruction can be done with medications and sometimes surgical interventions. Medications such as finasteride are used to help shrink the prostate gland. Other medications are used to relax the bladder, prostate, and urethra and allow urine to pass. Surgical intervention would be performing a TURP, which stands for transurethral resection of the prostate. In this procedure, the surgeon can remove all or part of the prostate. This concludes our discussion on the topic of BPH. Thank you for listening.